With manual extraction, I think that I can feel the graft, the skin much more better.
FUE versus DHI.
Sometimes I suggest FUT technique.
Nowadays, the most of surgeons says like with the micromotor it's easier.
Of course, you are right.
Amici di YouTube, sono anni che me lo chiedete. Oggi finalmente a 3 anni dopo il mio trapianto di capelli sono tornato a trovare il dottor Kaan Päkkiner che mi ha ospitato qui nella sua nuova clinica. Tra l'altro abbiamo girato un video assieme che è già uscito in cui vi mostro tutta la sua nuova clinica e oggi faremo un'intervista esclusiva con il dottore. Let's start from the beginning. When did you decide to become a hair transplant surgeon and why?
This is a frequently question to me. Many years ago I was graduated from a military medical faculty. I worked few years in the military and then I left and I started my other business life. I was always asking to touch the people's life and help in a really different way. I wanted to do something about cosmetology and I met some few colleagues in this field. I started to see something more about hair transplantation and the adventures began many years ago in Ankara. I got really big experiences in the beginning and then I was ready to start for my own business.
But you start like an assistant?
I was started as an assistant doctor, not as a nurse or something else. I did everything.
Okay.
I came from the kitchen of this business. I count the grafts, I classified the grafts, I make the bandage. I did everything. I know every step of this business. This makes me more confident about what I'm doing and also how can I improve myself. Then I did implantations, I did extractions, I did plannings, airline drawings. Nothing left that I don't do.
And how did you develop your own surgical styles? Because it's very easy to look at your before and after. You clearly see the hand of Kaan Päkkiner.
It's about ambition, I think. I love my job. Otherwise, it's impossible to do this kind of job. Needs too much fatigue. You have to be patient. You should need your time. You can't be quick. And then besides the medical side, there is an aesthetic point of view in this business. It is very important. You should know about hairline drawing especially. And I have all my technique about giving more density and about building the hairline design.
Can you explain how your technique works? How you do hair transplant nowadays?
In our methodology, in my clinic, still we are doing the extractions by manual punches. We are not using other tools for extraction. Using manual punches makes us feel better and we are still going on. I don't know time will bring in the future, but I'm happy now about the manual extraction.
Can I ask you why? Because nowadays the most of surgeons says like with the micromotor it's easier.
Of course, you are right. Micromotor, everything easier and faster. Especially in 1 hour, you can take even 1,000 or also more grafts. But with manual extraction, I think that I can feel the graft, the skin much more better comparing to the motorized tools. I want to feel the skin and I like to solve the puzzles because extraction is not same on every patient. Every patient has own skin character, different hair structure, and you have to find the best extraction method. I like to solve this, and we are not doing pre-made incisions. This is another difference than other clinics, most of the other clinics maybe. We are doing one by one, making one incision, and we are implanting the grafts immediately after this incision. This is called stick and place, but we are not manipulating the grafts. This is another frequently asked questions about stick and place implantation. They ask me, don't you damage the hair while implantation? No, we are not damaging the grafts while implantation. We are very meticulous about the implantation. We are holding the grafts on the safest part of the graft, not on the bulb or on the basic stem cell area. We are manipulating the grafts with the safe way while implantation. Also, dense packing.
Exactly. You are famous about that.
We are working too much about dense packing. One by one implantation and using forceps, in my opinion, are really critical points about dense packing and also our magnification. I'm using 6 times magnification to see every details. It makes easier for me to increase the density.
And what is the maximum density you can reach with dense pack?
Different cases you can go really high amounts about density. On a proper and suitable case, we can go up to 70 grafts per each square centimeter. These are limit, of course. This is not my average, but you asked me about the highest limit.
Yeah.
70 grafts per each square centimeter we can do, but the graft's thickness should let us. The patient's skin should let us. The bleeding should be optimum. Many circumstances should come together, then we can go up to 70. But mostly I'm doing 50 grafts per each square centimeter, and this is a really good density. Can make more than 90% of my patients satisfied.
And natural hair density is like 100.
Nearly 100 we can say. It can decrease, of course, depending on the origin of the patient, but we can say 80, 90, 100. These range is the good range to describe the natural density.
I'm really curious about this question because I think it's the most discussed question on social media. FUE versus DHI. Because many people say every time with DHI you can reach more density, but I'm the proof with FUE you can have density. What is your opinion about that?
First, I want to say something about the FUE and the DHI.
Yeah.
These are not things that we can compare each other. FUE means follicular unit extraction. Extraction of the grafts one by one. DHI means a direct hair implantation, and it describes the implantation technique done by the implanter pens mostly. Going high densities with these implanters are possible, but important thing is the performer, the doctor, the assistant. He should be very experienced. He should know the tool and he should know how to use it. And it needs time and experience. For example, I'm doing forceps implantation and I can do everything. I can adjust the graft number. I can adjust the density as however I want. But for a beginner, this forceps implantation could be very chaotic. So in an experienced hand, implanters are okay. But for a beginner, can do nothing with the DHI technique, with the implanters. So important thing is not the method, not the technique. Important thing is the experience.
There is another thing, it's crazy in my opinion. Some clinics let the patient choose the technique of the hair transplant.
It can be a marketing strategy because it's not like a choosing and ordering as a food. It's depending on the circumstances of the patient, and these circumstances should be evaluated by the doctor. And if the doctor says that both techniques are okay, but your situation is more suitable for this technique, by this way we can increase the density, for example, but the techniques cannot be the same.
If one surgeon starts now, it's important for you, he have to know how to use manual FUE.
If he wants to know how to use manual FUE, he should attend too many workshops because he can't do it and he can't learn it by himself. Surgeries are always like that. You need to see the hand on the field and you should try. And it's not easy to get experience with the manual technique. Micromotors can make it easier for a beginner. These kind of tools can be safer for a beginner.
And FUE and FUT. FUT in 2025 have sense in your opinion, or it's like part of the past?
No, I don't think that it's part of the past. Sometimes I suggest FUT technique. I'm not performing FUT, but for high Norwood classifications, for the first surgeries always, because you can't manage with one surgery to cover all the balding area. It can be logical with the FUE technique, or maybe a combo technique can be done, okay? FUE technique and the FUT technique together. Also, it can increase the total amount that can be harvested in one time. But in these days, for small Norwood classification, these patients doesn't want to see a linear scar on their donor area, and that's why they prefer FUE technique for their hair transplant.
And maybe an FUT scar can be fixed with an FUE hair transplant.
Of course. We did many times in the past. We try to fix the FUT scars. And sometimes we implant body hair, especially the beard grafts. We don't want to spend head donor area to fix the linear scar. We use the beard hairs to fix these linear scars.
And about body hair, the most of clinic use like beard, but there are other body hair you use.
My other option is the chest hair. If the patient have a really strong chest hair, I want them to prepare by shaving and trimming the chest area before the surgery. Like 3 months ago, they started to trim every 10 days. We try to increase the anagen phase of these grafts. By this way, we can harvest more successfully on the chest area.
What's the best age for a hair transplant, in your opinion?
Also, in that situation, I can't stuck on one age, but which age, it doesn't matter. Firstly, you have to stabilize your situation with treatments.
Yeah.
If you don't stop your hair loss, it doesn't matter. You are waiting for the hair transplant in your 40 age. But if you are getting your treatment and stop your hair loss around 25 to 30 ages, sounds very nice to do this operation. We have many patients older, of course, starting from 25 up to 70 years old. Before 25, we should be very careful. We should be sure about the treatments, how it's going on, aggressivity of the hair loss. Also, we are getting some more information about family story.
About the transplanted hair, the hair falls out after
3-4
weeks,
weeks,
and we call it shedding. There is a way to avoid this situation.
Honestly, there is not a secret about this. These are very frequently asked questions to me because many of my cases doesn't meet shedding after operation. They go on growing, but I have not secret about it. I'm trying to be very careful about the grafts while extracting and implantation. I'm trying not to make too much trauma on the recipient area. Maybe it can be a secret. Some of my cases coming after few months without any shedding, like in the 4th month, in the 5th month, we reached almost the full result. It's very surprising. I'm very happy about it, but we always follow the normal process. We need to wait always 1 year minimum. If we get the result earlier, we will be happy, of course, but we should wait the shedding after 3-4 weeks after the operation.
And in which cases you refuse a patient?
I refuse too many patients. The hair loss should be stopped. The treatment is very important.
Important or mandatory in your opinion?
Yes, I mean mandatory. If the patient has an ongoing alopecia, they should need the treatment. It's mandatory because otherwise you can solve all of your hair problems with hair transplant. You need to do something by yourself. You need to help yourself. I can do my best with the surgery, but if you go on losing your own hair, my surgery can look like an unsuccessful, but in reality it's not. Hair treatment is very important and mandatory. If you go on losing hair, I can't accept you. Some kind of dermatological problems, scarring alopecias, these are very difficult cases and we have to think more than twice about scarring alopecia. Psoriasis, we should be very careful about psoriasis. If the patient is not controlled with the treatment in psoriasis cases, it should be very difficult after surgery because the hair transplant can inflame the psoriasis.
Big Norwood, like Norwood 6, Norwood 5, you accept to do it or it's too late?
It depends on the donor area. If he has enough donor area, yes, we can start. Minimum 2 surgeries, it should be. I don't like to solve all of the problems and I don't like to cover all the bald area in one time. I don't like mega sessions. I like to harvest maximum 3,500, maybe 4,000 grafts maximum in
one surgery.
One surgery. I don't like more.
It was 4 days in manual FUE extraction.
3 days,
Okay.
sometimes 4 days, depending on the case.
It's a big job. Are doing consultation by photos a limit, in your opinion?
Yes, photo examination limits us because we are asking photographs by proper angles, directions and distance. Sometimes we can't get these points. They will not be so proper. We need to ask again and again. And sometimes we can't decide by photos. In that situations, if it's possible, I invite them to my clinic for a face-to-face examination. But most of my patients coming from abroad, outside of the Turkey. So 99% of my consultations are done by photographs.
Is shaving the recipient area every time necessary, or there is some cases it's like the same to not shave all the recipient area?
Every case is different. Sometimes it's better to shave all the recipient area. Sometimes we don't need. If the area is clear enough, we don't need to implant between native hairs. We don't need to shave the recipient area. But for repair cases, for example, he had one surgery in the past and is not satisfied about the density, and we need to increase the density on the recipient area. In that cases, I want to see all the area clearly under magnification because I have to spread the grafts in a homogeneous way on the area. In this situation, I prefer and I suggest full shave on the recipient area.
We talked about mega session, but what is your opinion about mega session like 11,000 graft cases?
This sounds too much to me. In my opinion, we have to save the patient's donor area because life is going on and we can't predict everything about patient's future. We have to be ready to every possibility. Sometimes 4,000 can be too many for a guy, but as a high limit, 3,500, 4,000 can be fine as a maximum limit for the one surgery. Also, I believe that we can cause a trauma for the grafts on the donor area that we didn't harvest. They are affected in a negative way, so we need to save the donor area.
After a surgery, which medication for you are essential and which one do you prefer?
If we treat androgenetic alopecia, we have to go on blocking dihydrotestosterone. I will not pronounce the names, the generic names. Everybody knows these, but there are some alternatives. We need to use them. We shouldn't stop them because ongoing alopecia is an alarm for us. We should stabilize and stop the hair loss with these treatments. Some kind of lotions, creams, some saline solutions. Yeah, these are fine for just immediately after the operation. Help for the recovery.
I want to ask you about new technologies. There is like robots or AI software that really help with hair transplant surgeries.
Yeah, nowadays there are robots, too many softwares helping the surgery. I really like them, but I believe that we can't leave the robot with the patient alone. The doctor should always control the extraction and implantation. I know some softwares helping a lot the performance and the assistance during the surgery, the classifications and counting the grafts. I'm using them and they are really helpful. And day by day it's getting better.
Doctor, it was a pleasure and an honor to be here with you. Thank you for your time.
Thank you. You're always welcome, dear Ettore. It was a pleasure for me to host you after many years and see you with your great results.
Ragazzi, io vi lascio i contatti del dottore in descrizione. Se volete venire a trovarlo, ovviamente la sua clinica è ad Ankara. Grazie per la visione e noi come sempre ci vediamo alla prossima. Ciao!